Hello friends, this is Mira with Breaking Bread with Mira, and I just wanted to share this moment with you. I'm about to go into Summit Chiropractic. I'm here to get another adjustment, and just to give you some background, I had a back injury earlier this year and I've been dealing with it. So today I'm going to share with you some information from the doctor, because if I'm going through this, I feel like there's other people going through this, and if you could find some relief by getting adjustments or working out and eating better, then that's my goal, is to share that with you, and my purpose is to make my testimony. So stay tuned. We're going to talk to Dr. Werner now, and he's going to answer some questions that I received from some of our audience on our DMs in regards to how to take care of your back, especially while you're working. So good afternoon, Dr. Werner. I'm so thankful for the time that you're giving us today. And can you tell our audience, introduce yourself and tell us a little bit about your educational background?
Okay, I'm Dr. Werner with Summit Chiropractic. I went to school up in Michigan at Central Michigan University. I went to Palmer Chiropractic College down here in Florida, and I got tired of the snow, so I decided to stay down here.
How long have you been with Summit Chiropractic?
Dr. Fike and I opened this office in 2013.
Excellent. As you know, when I walked in here, I was in a lot of pain, and I was struggling with the idea of having to have surgery. But when you reviewed my x-rays, you actually came up with a plan of attack. And what I really appreciate is that you actually took the time to explain in detail to me what was wrong with my back and my alignment, and what the treatment is going to be. And that's something that really gave me hope and relief, because it was starting to take an emotional toll on me. So can you share with our audience how is spinal alignment connected with the central nervous system?
So with the spinal alignment in the nervous system, is basically your spine has to be in the perfect position in order for those nerves to free slowly and get the information from the brain to the rest of the body. Anytime there's a change or pressure on that nerve, it affects how the electrons and all that information goes through the spine. So it only takes about the pressure of a dime to affect change on that.
Wow.
So by putting all that position of the bones back in the right spot, it takes that pressure off and decreases pain, but also improves the amount that the muscles can move and activate the way they're supposed to.
So if someone is not properly aligned, what kind of symptoms they need to watch for to let them know that they need a realignment?
Usually restriction range of motion. Most people, if they just raise their arm above their head comes down. That's an easy one. Another one that I see a lot, especially in modern day texters and things like that, is if you sit up as tall as you can and try to straighten your leg all the way out, you should be able to go to neutral. Most people who sit at desks and all that, they can only raise their leg a little bit in there. So those are two really fast ways to stay.
Quickly, how can someone, like you just mentioned, someone who texts or they're on the computer all day and they're sitting all day, how can they protect their back, their lower back, from injury?
Really, mindfulness is, most people, they don't realize how bad out of shape they are until something hurts. You shouldn't be waiting until you feel pain. You should be trying to stand up and walk pretty consistently. But the biggest thing is stretching. Just throughout the day, I'm a big proponent of doing yoga or Tai Chi at least 2 or 3 times a week, and at least anywhere from 5 minutes to a half hour of stretching almost daily, because our body really craves motion. And if we're sitting for 8 to 10 hours stuck in this position, or even worse, head down, legs crossed, stuck in that position, our body learns that that's what normal is. So if we're not stretching and moving and we don't even realize how tight we are, we're stuck that way and we get pain.
And doctor, can chiropractic therapy help someone like me, for example, find relief without having to use opioids?
Definitely. One of our big pushes is we work with the VA system a lot, and that's one of the things we track a lot is how many pain medications they're on. Some people come in, they're on 2 or 3 different pain medications, muscle relaxers. Over the course of about a month and a half, it goes from daily down to every other day. We have some people that get to the point where they're no longer on it. We have some patients that have been coming in for a while, but they've been on pain medication for 10 or 20 years, and we finally get them moving right, get their body functioning and actually healing. And they don't need those hard drugs that affect their kidneys and liver and all that.
That's awesome. Well, I personally can tell you that every time I come here and you have worked on me, I have felt relief, and my body is definitely shifting to a right path. And I'm looking forward to when, the next 2 weeks and I can start working out again. So can you tell our audience how they could find Summit Chiropractic and what other services you offer here?
Well, the easiest way to find us is either giving us a call at 407-203-6745 or to check us out on our website at summitchirofl.com. We have a lot of there. Or you can just Google Summit Chiropractic, Orlando, Florida. We show up there. We offer massage. We work with a lot of teaching people how to exercise. We do a lot with communicating, teaching people how to exercise properly, making life advice. We also do nutrition. So we try to do a well-rounded approach to health.
Excellent. Thank you. I want to thank you, doctor, for your time, and thank you for everything you're doing for me.
You're welcome.